Good morning. This morning, I'm going to start with an update about our overdoses and fentanyl-related overdoses, and then move into the COVID update. This weekend, a news release was issued warning islanders of the presence of fentanyl, a highly potent opioid in the province, following an accidental overdose involving the drug. This most recent fentanyl-related accidental overdose death brings our total to 3 accidental opioid-related overdose deaths involving fentanyl in 2020. The first of these occurred in May, a female in her 20s. The case investigation is now closed. It was an accidental mixed drug overdose death involving fentanyl. The second occurred in early July, a male in his 20s. The case investigation is now closed. It was also an accidental mixed drug overdose death involving fentanyl. The third occurred this past Friday. The coroner reported an accidental overdose death involving fentanyl, a man in his 40s, to Summerside Police and to the Chief Public Health Office late on Friday. Investigations are still ongoing. Surveillance for accidental opioid-related deaths began in 2016. And prior to 2020, PI recorded 1 fentanyl-related death in 2016 and 1 in 2018. It's important to note that not all accidental opioid-related overdoses are fatal. The majority, 96% of accidental overdose cases involve mixed toxicology. So that's 1 or more opiates combined with 1 or more non-opiate substances such as alcohol. From January to March of 2020, there were no cases. And from April to June, there were 9 overdose cases not resulting in death, 6 of which involved fentanyl. And from July to September, at least 3 overdoses have involved fentanyl, and these were non-fatal. Anyone consuming street drugs, not only opioids, but any drug in pill or powdered form, should take steps to reduce the risks, carry naloxone, and inform others who may use drugs that naloxone is available. If an individual feels that they need a naloxone kit, they can contact the Provincial Needle Exchange Program toll-free by calling 1-877-637-0333 or visit a program site. Free kits are also available to clients of mental health and addiction programs and select community groups, and there is more information online. And then now moving to our COVID update. So there are no new cases of COVID-19 to report today. We currently have 3 active cases of COVID-19 in the province. These individuals are doing well and remain at home in self-isolation. Since the pandemic began, we have had 61 cases of COVID-19 in the province, and all of our cases have been travel-related. We are now seeing the impact of a second wave of COVID-19 in other provinces. In the last week, we saw an increasing number of cases diagnosed in Canada. There was an alarming rate of increase, particularly in Ontario, Quebec, but also Manitoba. Ontario and Quebec accounting for 78% of the new cases last week. Nationally, the daily case counts of COVID-19 are in the same range as we had in April in the initial phases during the first wave of the pandemic. Hospitalizations and deaths are also increasing across much of Canada. While Atlantic Canada continues to report low case counts, we are paying close attention to what is happening in our other provinces. It is concerning to hear about the necessary but restrictive measures being reinstated and health systems being overwhelmed. The strain on the health systems experienced in other parts of Canada could occur in PEI if we had a small number of cases of COVID-19 with a large number of close contacts, or if we had a number of individuals with the virus needing critical care. It is for this very reason that we will maintain our pre-approval travel process, border security, and screening and operation isolation. These measures have been key factors in keeping our case count low in PEI. We will also continue to increase our capacity for testing and contact tracing. Last week, the rules regarding isolation and testing for workers who travel were clarified, and these changes are outlined in an order pursuant to the Public Health Act. We recognize some island residents who travel outside the Atlantic bubble must go back to their workplace when they return to PEI. Previously, some people have identified themselves as essential workers, and all of these individuals now have to apply under the worker travel stream. We are really moving away from the term essential worker. In reality, all work is important and essential to the individual. The changes that came into effect on Friday provide more options for PEI residents who must travel outside the Atlantic provinces and have to go back to their workplace when they return home. Effective October 2nd, these individuals must apply for approval to work isolate, and the application form is available on the provincial website. I am relieved to know that these changes are now in effect, and over the past few weeks it was clear that some individuals were not isolating when they should, and in some cases this behavior was unintentional, and clear communication will help. I have been concerned about the lack of clarity regarding the requirement to self-isolate or work isolate for a period of time, because it meant islanders were at greater risk of importation of COVID-19 into the province, especially when we see the increasing number of cases in other provinces. So this approval process hopefully will help provide clarity regarding who is work isolating and who is a rotational worker. And it will allow greater transparency and improve our ability to enforce the requirements to work isolate, including routine testing at regular intervals. And it's worth highlighting that testing is not a means of getting out of isolation, and testing does not replace self-isolation. For individuals who must return to their workplace following travel out of the bubble, they must apply for and be approved for work isolation with the support of their employer. Over 12,000 people have successfully completed self-isolation in PEI. And while many individuals would rather not have to self-isolate or work isolate, the great majority recognize the importance of following the rules for the sake of their health and the health of others. Islanders can be reassured steps have been taken to ensure individuals traveling to PEI from outside Atlantic Canada will know exactly what is required in terms of self-isolation or work isolation, and these measures will lower the risk of importation of COVID-19. We will be stepping up our enforcement efforts and ask for Islanders continued to support in reporting individuals who are not adhering to the work isolation or self-isolation rules. As plans begin really for Thanksgiving, I urge Islanders to keep their gatherings small and explore creative options to celebrate with family and loved ones this weekend. I know that this approach is challenging for some people who traditionally have very large Thanksgiving dinners and family get-togethers. Keeping our gatherings small and scaling back and celebrating is not going to be the norm forever, but it is necessary this year. Personal gatherings in a private residence are limited to a maximum of 20 people, provided there continues to be room to maintain physical distancing and good public health practices can be followed. So please be judicious in deciding to attend events outside your household. And just because you know people at an event, it does not reduce the risk of transmission of COVID-19. And along the same line, and we're getting questions already, I know many families are beginning to make plans for Christmas holiday season, and they are hoping that family and loved ones from off-island can come home for the holidays. Alternatively, some island residents may want to visit family outside Atlantic Canada. For Islanders who choose to travel outside the Atlantic bubble at Christmas, at this stage, there likely will still be a requirement to self-isolate when they return to Prince Edward Island. For family who travel to PEI from outside the Atlantic bubble, it is likely the requirement to self-isolate for 14 days will remain in place throughout the Christmas season. It is possible for family to travel to PEI from outside Atlantic Canada, provided they receive pre-approval under the Family Connection stream with the requirement to self-isolate for 14 days. And we recognize as well that this is challenging for students, for instance, returning home for the holidays. For individuals traveling to and from PEI within Atlantic Canada, and assuming the Atlantic bubble is still in place, there will be no requirement for that period of 14 days self-isolation. This is something that we will continue to look at over the next 8 to 10 weeks and reassess as we go. And it's possible that other options for Christmas travel and family gatherings may be feasible, but certainly at this stage, the self-isolation requirement is in place. Now that fall is here, community rinks are planning for a busy hockey, ringette, speed skating, and figure skating season. And like all other aspects of our society, COVID-19 dictates that things are different in our rinks this year. Rinks can, right now, host multiple cohorts of 50 people, participants, spectators, parents, provided that they have an operational plan and have one approved by our office. And these cohorts cannot mix, and consideration of entrances and exits and physical distancing must be maintained. And we know that the capacity of each rink varies in terms of numbers of entrances and ability to stagger arrival and departure, and the ability to have maintain that physical distancing. But while individual facilities are responsible for submitting an operational plan, efforts are now underway to assist facility managers to maximize the number of players, family members, and spectators that can attend events in rinks across the province. PEI will be launching the voluntary National COVID Alert app this Thursday, October 8th. The app will let you know if you may have been in contact with someone who has tested positive for COVID-19. If you decide to install the app, your phone sends out a randomly generated code via Bluetooth to any other smartphones within range, which also have the app. So if you ever test positive for COVID-19, during the follow-up with public health nursing, you will be asked if you have the app and if you wish to use the notification function. If you wish to do this, you will receive a one-time key to activate the notification. Other users who have downloaded the app and have come in contact with you will be notified via the app that they have potentially been exposed to the virus. The app will anonymously notify others who have been also using the app and who may have been in close contact, so less than 2 meters, for a period of time, for 15 minutes, that they have potentially been exposed to the virus. Notification is anonymous and information limited. The app will direct those who are notified here in Prince Edward Island to go and be tested. The app does not use GPS or track a user's particular geographic location. It does not share a person's name, address, or telephone contacts, and does not collect or store any personal health information. The app is available free of charge to Canadians and can be downloaded through the app or Google Play stores, and for Islanders, that will start on Thursday. Traditional contact tracing by public health will still continue. It's important to note that this is just one tool to assist in managing COVID-19 and does not replace traditional public health measures such as contact tracing. So I do encourage Islanders to consider downloading the app. While COVID-19 is impacting Thanksgiving plans for many Islanders, we can take time to reflect on this past year and the people and things in our lives that we are thankful for. We can be thankful that to date PEI has been successful in containing the spread of COVID-19 in our province. We can be thankful for the generosity of Islanders and their genuine willingness to adhere to public health measures, protecting the health of themselves and the health of others. We can be thankful for the many thousands of hardworking, caring, and dedicated workers providing services to Islanders during this pandemic, including our healthcare workers and the whole system, teachers, bus drivers, our grocery store workers, our media, our journalists, restaurant workers, and the list goes on. We can be thankful that, to date, those most vulnerable to COVID-19 and PEI have been spared of the serious effects of COVID-19, including residents in long-term care and others in communal living arrangements. We can be thankful that we can travel freely to our neighboring provinces and for the success of the Atlantic bubble. And we can be thankful to live in such a beautiful province with kind, caring, and resilient people. And I am thankful for you. I hope everyone has a safe and happy Thanksgiving holiday. Please continue to be compassionate to yourself and to others. Please continue to be patient. Please continue to be kind. Thank you. And I'll open it up for questions.
Brian Higgins, CBC.
Hi, Dr. Morrison. A question about the 2 active cases that were reported Sunday, I believe it was. It was reported that they had traveled outside the Atlantic bubble. Can you tell us, were they international travelers or merely travelers within Canada?
Hi, Brian. Both were outside the bubble. One is related to international travel, and the other case had more travel within Canada, but outside of the Atlantic bubble.
Thank you. And I think today you said that enforcement will be stepped up, if I heard that correctly. Can you tell us more about what that means? And I'm curious, with the work isolation, that seems to suggest a loosening of restrictions. But could you tell us more about that?
Well, I think when we're trying to clarify those people who are rotational workers and need to be tested regularly, but also certain workers who may need to return to work, but would need to work isolate. And work isolation, and I know we've talked about it before, means that while certain precautions are put in place while they're at work, wearing masks, maintaining a 6-foot distance, going to the grocery store, public functions, going out to eat at restaurants is not allowed in any type of self-isolation or work isolation. And so I think it's, as we're clarifying that isolation process and realizing that there may be some people who have either, even unintentionally not been following some of those isolation requirements, it is something that we have talked to our enforcement colleagues about, and we'll have more conversation in the days ahead about making sure people are isolating, but also making sure people are tested as we've laid out, and so it's. I think it's an important part of the process. We see what's happening in the rest of the country, and we're trying to acknowledge that some people do have to work in Prince Edward Island, but also wanting to make sure that those who need to be isolating, whether that's self-isolating or work isolating, continue to do so. It has made a difference here, and we need to continue to be careful in the weeks ahead.
Thank you.
Shane Ross, CBC.
Hello. I have a question about taxis. Can you explain what the protocol is for people flying in from outside the Atlantic bubble who need to travel to a place to isolate? Are they allowed to take a cab, or do they need to arrange to have a car waiting for them?
So, Shane, it's a good question. So when we are asked if someone is coming into, and it's a planned self-isolation requirement, but sometimes people have left a car for them at the airport that they can pick up and drive directly to their location of self-isolation. And if they were to take a taxi and they need to go to self-isolation, they should be in the back seat as far away from the driver as possible, and and have a mask on at all times.
Okay. My second question is about weddings. COVID-19 has affected a lot of weddings over the summer, and we'd like to know whether public health officials monitored or dropped by any of those weddings and asked to see the operational plans, and if action was taken against any wedding gatherings.
A good question. I don't know which if there were weddings that were dropped in on by public health officials, and I think it really would be if there was a complaint or concern identified that would have been brought to our office. But I wasn't made aware of any. But certainly I can find out if there was The weddings should have had an operational plan. Any wedding that had more than 50 people would have needed approval from the office. And so there was a lot of back and forth with organizers as part of those approval process. But in the smaller ones, I'd have to check, Shane.
Thank you.
Allison Jenkins, The Garden.
Yes, good morning. Just wondering about the overdose deaths and the increase of non-fatal overdose. Is there enough help for those people? It sounds like there's been an increase, whether it's presence of new drugs or increase in addictions. Just wondering if you can elaborate a little bit on some of the context behind what has this revealed to you, I guess, and what are you doing about it?
Well, and hi, Allison. I think, and we spoke a little bit about it earlier in the summer too, that, and I know we're going to be doing more of it. There's a few things. One, we have put in place a Narcan alert system with EMS, so that if Narcan is administered, it will flag. Create an automatic flag so that we're aware of it, and that's part of a ongoing surveillance. We have certainly communicated with a letter went out to all our physicians and nurse practitioners over the summer, alerting them to be aware and to test for in overdoses for fentanyl. We met again this summer with our enforcement colleagues about a rapid response plan with regards to overdoses, particularly opioid-related overdoses. And that's always really helpful to have that communication with coroner and the police services and our office. I know we are and I've spoken to them just this morning about increased communication campaign, and I think that's going to be really important in the days ahead. There's been discussion about Peers, working with Peers Alliance, the hotline. And as a project to be put in place for people who may be using, and I think that'll be really important. So it's a variety of approaches that we need to not to continue, but to augment as we look at what's happening here and also around the country. This is. They've seen the situation in other parts of the country, and it is of grave concern, and we need to continue to do more. So I think you'll see more from about overdoses and what we can do to continue to educate everyone.
Great, thank you very much. My next question is about the serology test. Just wondering where that's at and what the update is. Is there a test been picked, et cetera?
Yes, so the serology tests, I think you're speaking about the immunity serology, and that has been something we've been talking about for a number of months. It has received ethics approval for the the immunity serology study, and so the details are being worked out. We have someone in our office working on it as well, and along with the lab, and so we anticipate shortly having some more details about that.
Great, thank you very much.
Rachel Collier, Eastern Graphic.
Hi, I have a couple questions about testing. I'm wondering if you might know how many tests have been administered at each drop-in site at this point, and maybe if since those drop-in sites have opened, has testing increased overall, or has it changed? Maybe it's decreased, who knows?
Hi. So yes, overall the testing numbers have increased, and that's particularly since the beginning of September. We've noticed an increase in testing, and that has had to do with, I think, our easing of public health measures, but also people back to work and school. There were, in last week, 23% of tests were among those who were less than 19 years of age. And that's actually a little bit less than the previous week in that age group. There was actually a 9% decrease in the number of tests last week compared to the week before, but overall up since August. We have had over 37,800 tests performed in Prince Edward Island, and since last Tuesday, 2,423 tests have been performed. So that's a fairly large number. PEI continues to be second highest in tests per capita in the country in terms of number of tests per population.
I'll have the numbers for each drop-in site here with you today.
I don't have them per drop-in site, but those reflected an overall, as I mentioned, just overall increase in cases really from last month to this month in terms of September. But I don't have this specific number at each drop-in clinic, but that we can certainly get that.
Okay. And I guess just since you brought up Thanksgiving and mentioned, large gatherings still aren't recommended, I'm just curious, would going to multiple small gatherings in the short span of a weekend be any better than going to one large gathering?
I think you raise a really good point. You want to limit how many gatherings you go to. And it's about your contacts and limiting the number of people you're in contact with. So it is one is not better than another. I think it's at larger gatherings you tend not to know everyone who's there, and it can make contact tracing a little bit more challenging. But certainly think about where you need to go and how many social gatherings you would be going to. And I mentioned here in terms of the number of 20, that's personal gathering limits. And of course, there are organized events that have different gathering limits. And those are the ones that need an operational plan.
Okay, thanks for all your info.
Laurent Rigaud, La Voix acadienne.
Bonjour, Dr Morrison. J'avais une question sur le plan de nouvelle normalité que vous avez, qui a démarré le 1er octobre. Est-ce que maintenant les restaurants peuvent accueillir plus que 50 personnes s'ils ont des salles différentes? Quelle est la règle pour les restaurants aujourd'hui à Lille?
Alors, bonjour Laurent. C'est la nouvelle normalité, c'est pour les restos, et même avant la nouvelle normalité, les restos pouvaient avoir plus de 50 personnes si ils ont un plan qu'on peut voir au bureau. Alors, ils peuvent mettre peut-être 40 dans à moitié du resto et 30 dans l'autre, mais il faut garder la distance physique et avoir un plan de pas avoir les deux parties du restaurant qui est mêlés, ils vont pas que il va d'un côté à l'autre, mais on les a parlé et puis on a clarifié qu'il peut avoir plus de 50 depuis un bout de temps, mais il faut avoir un plan pour nous montrer.
D'accord, merci. Et j'avais une autre question. Vous l'avez dit en anglais, mais j'aurais aimé avoir la réponse en français sur Thanksgiving et Halloween qui arrivent. Est-ce que quelles sont les recommandations? Est-ce qu'on peut avoir une grosse fête de famille? Est-ce qu'on peut aller chez des gens différents? Qu'est-ce que vous préconisez pour ces fêtes?
Je pense que c'est l'action de grâce et pour les autres fêtes, on veut que si vous êtes en famille ou avec les amis, ça devrait être 20 personnes ou moins. Et puis, même avec 20 personnes, il faut garder au moins autant que possible la distance physique et laver les mains. Et puis, prendre soin de sortir seulement si vous avez vraiment... pensez-y avant d'avoir beaucoup d'activités sociales, de garder les activités entre un nombre de personnes qui soient un peu plus petits que normal. Je sais qu'il y en a les familles qui, normalement, a beaucoup de gens pour fêter ensemble et c'est pas l'année pour en faire. Alors, et puis, il faut prendre soin qu'il y a des personnes qui sont malades ne sont pas là et si vous ne sentez pas bien, il ne faut pas inviter les autres et de laver les mains, pas partager les ustensiles entre quand vous avez un repas et autant que possible garder la distance physique.
Merci beaucoup.
François-Pierre Dufault, Radio-Canada. François-Pierre Dufault, Radio-Canada.
I think that's it. So thank you very much. Happy Thanksgiving.